Hi everyone, I'm Dr. Lizo'riordan and welcome to my breast cancer vlog. You can hear my spaniel drinking in the background. I'm a breast cancer surgeon and this is my story of me having my second local recurrence of breast cancer, and I'm taking you through what happened to me, what treatment I'm having, to educate you, to entertain you. Hopefully you might find interesting and answer some questions. So I left you last time when I just had a biopsy of a tiny nodule that I'd noticed on my mastectomy scar, and I had a week to wait to get the results, and that week was really, really hard. That fear of, well, I knew what it was, but if it was a local recurrence, would it come back somewhere else? And it was really hard to distract myself to pass the time. But as luck would have it, that weekend, my husband and I had planned to do a bike ride to raise money for our local hospice, St Nicholas Hospice in Bury St Edmunds. And they need £12,000 a day to stay even. And I thought, if I can raise £12,000, can I persuade my husband to ride with me on our tandem, dressed in our Mr. and Mrs. Incredible outfits? And the night before, we'd only raised £3,000. My incredible husband said, yes, I'll do it. So we got on our bike. It was a really hot day. We got dressed up in our full gear with the masks and everything, and we went on our tandem and we cycled 30 miles, and goodness knows what the people we were passing must have thought as I was waving and saying hello. But it was great fun, and it felt really good to give something back after the bereavement counselling I had from them in January for free after Mum died. But all too soon it was time to go back into the clinic, and any of you who've had breast cancer will know the anxiety that you feel when you're back in that waiting room. You just feel that nervous energy, anticipation, fear. It's a really horrible place to be. And I was lucky my husband was able to come with me. He had time in his day to come and sit and watch me squeeze his hand dry. And getting the results was just the strangest thing. We walked in to see my surgeon, and my husband and I sat down, and she said, right, it's cancer, but you knew that. We'll get a CT scan and I'll see you next week to plan surgery. And that was it. And there wasn't anything else she needed to say. I knew it was cancer when they did the punch biopsy, but it was just so surreal it being over in a fraction of a second, and my life has changed again. I was initially diagnosed with a mixed cancer that was ductal and lobular, and this was the lobular cancer that had come back, the same as last time. It was a grade 2, ER positive, HER2 negative, exactly the same as before, which in a way was reassuring. And then I was left with another worry. I was going to have a CT scan to see if my cancer had just come back on my chest wall or if it had come back somewhere else. And I just had this sick feeling inside. I talked about last week, just how bad is it going to be? And going to have the CT scan was really triggering, because the last time I'd been in the department was with Mum when she was first diagnosed with her bone cancer, and all these memories kept coming back. And you try and be brave and just smile for everyone else around and say, yeah, I'm fine, everything's fine. But inside I wasn't. Now, this is the position you're in when you have a CT scan. You lie flat. I got to keep all my clothes on. I wasn't wearing a bra, and I had contrast. And we give you contrast so we can look to see how your organs are as the blood is flowing through them, and that can help light up some things that aren't seen without contrast. And a lovely man put the cannula in my arm, and he checked it, flushed it, and then I was on the CT scanner lying flat. And they don't take very long. It's over in a couple of minutes. You lie really, really still, and the machine moves you through the CT scanner, like going through that big donut. And once you're in position, they tell you to take a big breath in and to hold it. And then as you're holding your breath, the machine pulls you back out through the CT scanner. And the reason you hold your breath is when you breathe in, your lungs are inflated, so it's really easy to see anything inside your lungs, and it stops your diaphragm moving up and down, which can change the position of the organs inside your tummy. So having a big breath keeps everything inside you nice and still whilst the CT scanner takes its picture. And then you come back out, and then they do it again. And I remember the first time I had contrast with a CT scan, because I'd never had one as a surgeon, and they told me, you might think that you wet yourself. Really? But it's true. When they give the contrast, the first thing I notice is like a funny metallic taste in my mouth. My nose kind of itches. And then there's this warm rush of almost like fluid, like a really warm, fuzzy feeling right down in my groin where my bladder is, where I pee, and your hands just want to go there and say, oh my God, I've wet myself in public. And you haven't, you never do, but you just feel like you have. It's the strangest feeling, and it only lasts a second or two, and then they do the scan. And then I went home to wait, and that was a really, really tough week. I've got a lot going on with a book launch, doing interviews and promotions, and yes, it's exciting, and I interestingly did another talk about local recurrence with a small breast cancer group, all the while trying to keep my cool. It's absolutely fine. Really, really hard. And the day I went to get the results was difficult because we were babysitting for my step-grandchildren. They'd come up to stay with us for a couple of days, and there was no one else who could look after them. So my husband had to stay at home looking after my grandchildren, whilst I went in to get my scan results. And although the chances were that this was just another local recurrence and it wasn't anywhere else and I'd be absolutely fine, there was just this tiny feeling deep inside thinking, what if? What if it's not okay? What if I'm now incurable? And sat in that waiting room by myself, trying not to make eye contact with anyone who might recognize me. Oh God. I never want to have to do it again, but I know I might have to in the future. It was really, really hard. And got the sense of relief when I got taken into my surgeon's room and she sat me down and said, yeah, it's normal. And it was like I can breathe again. I can breathe. I know, and I'm lucky that it's not stage 4 and I'm still treatable and potentially curable again. But oh God, I had no idea when I was a surgeon how hard it is for our patients to come back to the clinic, to sit in that room, to relay off that emotion of everybody else in there and that sense of relief. And it took me a while to realise that I had to phone my husband and my brother and my dad and tell them everything was fine, because I was just in this, I don't know what to do. I need to go and eat cake. I don't know what to do. I need to go and eat cake, because I hadn't been sleeping. I'd been off my food. The anxiety of just lying awake until 3 or 4 o'clock in the morning, just thinking, wondering, mind buzzing, don't want to eat, can't concentrate, can't do anything. I was walking the dog and that was the most I could do to keep my exercise up, but I was just, and I hated the fact that I literally had to wipe my diary clean for these 2 weeks because my brain just couldn't function. I couldn't write, I couldn't do anything. So that was a huge relief. And the next step was to plan surgery, and that's when it potentially got a bit more complicated. So I initially had a nipple-sparing implant reconstruction with a scar underneath where your breast meets your chest wall. And when I had my local recurrence, we opened up that scar to take the implant out, and then there was another scar going here to take out the recurrence on my chest wall. And I'd had radiotherapy, so the skin was actually quite tight and stuck down. And my surgeon hoped there'd be a bit of movement, so what she could do is take away a strip of skin and pull these edges tight to close it. But if that skin is pulled too tight, then the blood supply to the skin is really bad and it doesn't heal, and radiotherapy can damage the blood vessels in the skin anyway, and there was a real risk that I might need to have a skin flap from somewhere like my thigh or my back just to close the hole in my chest to remove an 8mm nodule. She thought she could get away with it. And I really hope she could, because I didn't want to have a big operation for such a tiny thing. So it was kind of fingers crossed. And I then spent the next week trying to get myself sorted for surgery. Can I clear the decks? Can I get my diary done? Trying to exercise to get myself as fit as I could. Trying to find a pair of pajamas because I sleep naked because of my hot flushes. All those things about having an operation again. And I'll let you know how it went next week. I'm Dr. Liz-O'Riordan, and thanks for watching my breast cancer vlog. And if there's anything else you want to know, let me know in the comments. Make sure you subscribe, and I'll see you next week.